Hi, everyone. I'm really excited to introduce our next keynote speaker, Dr. Elena Craft. Dr. Craft is a Senior Director of Climate and Health at the Environmental Defense Fund. She's based in Texas and has worked to identify and reduce toxic exposures of air pollution, including during climate fuel disasters like hurricanes, and has testified extensively at local, state, and national forums on air pollution policy. She has helped a historically Black neighborhood along the Houston Ship Channel to install the largest community-owned and managed network of air quality monitors in Texas. Dr. Craft has pushed forward research efforts to protect public health, including a leading role in the establishment of the Texas Flood Registry to understand Hurricane Harvey's toll on people's physical and mental health. She serves as an adjunct assistant professor at the University of Texas Health Sciences Center and Texas A&M University, and as a fellow at Rice University. Without further ado, I'm going to invite Dr. Craft to share her screen and present. We'll have a Q&A session afterwards again, so feel free to submit any questions in our Q&A box.
Thank you so much for that nice introduction. Are you able to see my screen okay?
Yes, it looks great.
Okay, great. So first of all, just thank you for having me today. This is just an amazing opportunity, and I can't even believe I'm sharing the stage with such revered scientists. I'm really grateful. So thank you for that. It's also been one of the most well-organized events. So way to go, students. This is terrific. I wanted to just share maybe a little bit, let's see here. I'm gonna just make sure I can advance the slides. Okay. So just in case you don't know much about Environmental Defense Fund, we're a little bit of, I'd say, a non-traditional environmental NGO. We were actually started by scientists back in 1967. These were scientists who were concerned about the pesticide DDT. If you remember, they were spraying DDT to try to get rid of mosquitoes, but the DDT was actually causing eggshell thinning, and that was resulting in the loss of some of our most revered birds, like the California condor and bald eagles and so forth. And so the scientists actually went to their local county to ask them to stop using DDT, and the county said no. And so what they did, which is kind of common today, but was really unheard of back then, was that they teamed up with lawyers and they went to court on behalf of the environment. And so eventually they ended up winning, and in the process they had garnered so much national attention and national support that they ended up incorporating as EDF. So we just celebrated our 50th anniversary as an organization a few years ago. Sadly, Art Cooley, who's in the top left of the photo there, passed away last month. But EDF was born in his living room. So it's just a great. It feels good to be part of an organization that had that kind of a start. And I mentioned that because we are grounded in science, and we use science to develop our advocacy positions. We're also guided by market-based principles, and we've worked with a huge array of companies and industries. Our feeling is that we're not going to solve the climate or pollution problems without working with industry and without working using capital markets. And so that is one of our strategies, to use science to guide us in the development of advocacy. And we do really big things, actually. The photo there in the middle is actually a rendering of a satellite that EDF is launching at the end of this year. It's called Methane Sat. And the reason that we're launching that satellite is because it's going to be able to capture the highest resolution methane concentrations ever to be collected. And this information is going to be, published and available to the public. As you all may know, methane is not as there's not as much methane in terms of a greenhouse gas as, say, carbon dioxide, but methane has a much higher warming potential. And so it's the fastest way to reduce climate pollution is actually to reduce methane. So we're hopeful that shining light on where these methane leaks may be, for example, is going to help us get to where we need to be faster. And so, in my view, EDF is, my feeling is that EDF is scientists who are actually doing something that will make a difference. So in other words, science in the service of communities. And before I get into the Climate Vulnerability Index tool, I just want to share a little bit of background as to why we started working in this space and really the evolution of the tool. It came about because of extreme weather events that are happening more frequently these days, just like Dr. Haley mentioned. You can't avoid it. Our first major effort really came after Hurricane Harvey. And to this day, it's just mind-blowing the amount of rain that came with that event. It brought 275 trillion tons of water to the Houston region, which was heavy enough to cause the Earth's crust to drop by 2 centimeters. So you can imagine the impact that had. And we knew from our previous work in the area that whenever those major storm events come, usually what happens is a lot of the facilities end up being damaged. Some of them are in the floodplain, and so they're flooded. And so there's all kinds of problems. They end up having to start up and shut down using unscheduled parameters and so forth. And so what ends up happening is there are a lot more emissions than there usually would be with just normal operations. And these are the types of events that we know contribute to the larger issue of health disparities and increased vulnerabilities, often in communities that are least able to manage the risk. And this is all at a time when traditionally the network of air monitors that are up in a region are shut down because they don't want the monitors to be damaged by the storm. So there's not a lot of chance to collect information about air quality in the midst of a disaster. And so we knew that was likely to happen, that we were likely to see emission events. And so EDF, as an environmental nonprofit, brought out a mobile monitoring unit from California, a company by the name of Entanglement Technologies. They have or at the time, it was actually a very new instrument that was really remarkable in that it's able to operate in 2 different modes. One is kind of a scanning mode to tell you, are there VOCs present in the area? And then another, which is an analytical mode that can actually speciate VOCs. So once you find a plume in the area, you can actually characterize it and really get a sense of what kind of emissions might be, or what kind of exposures might be present because of that emission event. And I can't even tell you how unbelievable it was, but literally one of the first measurements they took, benzene concentrations were about 325 part per billion, which is an order of magnitude higher than what you'd expect in just an urban area. And so we knew that there was a real problem in that community, which was the Manchester community, which is a kind of your traditional environmental justice neighborhood. We also knew that there was a problem there because of the lived experience of the residents. When they opened their doors after the storm, they were nearly knocked over with the overwhelming fumes coming from the VOCs and the release of all the chemicals from the Valero plant, which is right next door to their neighborhood. And so you might think, well, why is an environmental group going out and doing all this monitoring? Isn't the state environmental agency doing this work? And I wanted to include this slide because this was a report that our state environmental agency, the Texas Commission on Environmental Quality, released just about 2 weeks ago. And basically what this report says is that that they don't need to deploy wide-scale handheld air quality or mobile monitoring instruments in affected areas because they say that there's not enough information to show that air quality is a problem after these kinds of weather-related events. And so this really angered the communities because this is not the lived experience of the communities. They know full well that after these large-scale climate-fueled weather events, that these huge releases occur, and that is a time when they are most vulnerable to exposure to any number of compounds, many of them cancer causing. And I guess I should just throw in there that in November of last year, there was the largest cancer cluster ever identified in the city limits of Houston. So we know that there are problems in these communities. And so over time, over the last several years, we've responded to a number of disaster events. We've published a lot in terms of scientific activities following disaster response. We've worked with Rice, as was mentioned in my bio, to form the Texas Flood Registry. Originally, this was actually called the Hurricane Harvey Registry, but after the region kept getting flooded, we had to change it to the Texas Flood Registry. Because we kept sending out new surveys asking people about their health and about their housing as a result of those large flood events. And it turns out that, obviously, I think it's probably not surprising that that stress and health conditions are exacerbated by these flood events. And so what we want to do is to use this information to share it with researchers and to public health officials to identify health trends associated with these kinds of events and to develop plans to reduce risk from future storms. We also worked with Baylor College of Medicine after a large chemical fire that burned for 5 days. Again, all part of this larger effort to understand exposures and risks to those who are most vulnerable. And what we really were trying to do and what we continue to do is to use all this information to develop a tool that can help characterize risks and vulnerabilities in specific neighborhoods in a scientifically rigorous way. And so there are lots of groups that have actually been working on tools to try to do just that. Probably the first one is Environmental Protection Agency's Environmental Justice Screen. It takes data at a national level and provides essentially a map outlining vulnerabilities. The challenge with this tool, though, is that it only has data at a fairly low geographic resolution. So it doesn't help really with characterizing communities or neighborhoods at a higher geographic resolution. It also doesn't take into account data that might exist regionally or statewide, for example. And so there have been, as the previous slide showed, a number of groups and agencies that have developed more tools that are specific to smaller geographic regions. And so that's what we did. We partnered with Texas A&M University to develop a tool that we call HGB EnviroScreen. That stands for Houston, Galveston, Brazoria, which is that metropolitan region of Houston. And the tool uses what we call ToxPi. That stands for Toxicological Priority Index. It's essentially a software package that calculates a unitless number that can be used. In its first iteration, it was used to rank chemicals that you might want to compare. But the concept can be modeled or replicated to compare compilation scores of a variety of different health and environmental domains. And we use this software package to generate information at the census tract level of granularity. And one of the great things about this tool and what made it different from some of the other tools that are out there is that we really developed this tool hand in hand with the local communities. We were trying to figure out what is the information that would be most useful to you to have in a tool like this. And so the domains and indicators that are included in an HGB and virus screen are domains including health, social vulnerability, flooding, environmental sources, and environmental exposure and risk. And so what we do with that information is that it all gets we have multiple domains and we create an index score. And that's at the census tract level, and it essentially gives you a rank. And because it has that local data, you can actually pull out components of the different domains to figure out what is driving the risk in that particular area. For instance, you could say whether that risk was being driven by underlying or baseline health indicators, if the risk is being driven by social vulnerability, if the risk is being driven by sources, pollution sources, for example. And so you end up with a pie that looks kind of like this, where you're actually able to look at each of those indicators in context with all of the other indicators to help figure out what is driving the risk in that particular area. This is the tox pie for Galena Park. It's one of the highest priority areas in the Houston region. And one of the things that's nice about this particular tool is that you can actually weight those domains differently, or you can give them the same weight, or you can pull out a domain to see, investigate further what some of those other indicators are contributing. In our tool, we have given each of the domains equal weight. The rationale behind that was because we couldn't come up with a scientifically rigorous reason to weight them, or how we might weight those different domains. And so you can see in this slide here how you could have similar rank scores in different census tracts, but those rank scores may be generated by vulnerabilities in different indicators. So, for example, the one on the left has less baseline health vulnerability, but more vulnerability due to environmental sources. And that score could be similar to an area where there's a higher baseline health vulnerability, but less environmental sources, less vulnerability from environmental sources. And this is the paper that was that resulted from this effort. This is actually a live tool. You can actually go to HGB and virus screen and play around with it and drill down and look at different areas across the Houston region, which is kind of neat and interesting. And this tool is actually being used for a purpose. What we did with this tool is that we are using it to help communities understand those variables that are contributing to their risk. So they have presented the tox pie information at permit hearings. to try to ensure that that they don't have an additional cement batch plant located in their neighborhood if they are at the higher end of risk from environmental sources or pollution sources. For example, we are using that tool to try to prioritize different transportation projects and so forth. And then ultimately to have a way, a scientifically rigorous way to show that these are the areas where there is increased vulnerability. Because if we are able to do that, then we're able to identify solutions of how we might address those vulnerabilities. And in fact, the information that was generated by the tool was actually the underlying information that was used that inspired the current EPA administrator, Michael Regan, who's actually a former EDFer, to highlight Houston on his recent Journey to Justice tour. And some of the issues that had been identified by those communities using this ToxPy software and the information was the basis for helping to outline what next steps and what solutions will be taken. Now, of course, the ToxPy and the HGB EnviroScreen is really focused on baseline health, environmental vulnerability, and so forth. And we recognize after all these years of these climate-fueled weather disasters that it would be great if we could expand upon that tool to include climate vulnerabilities. This is a lot more difficult, and it turns out, to try to establish domains to guide development of a climate vulnerability index tool. But again, it's a process that we're doing where we're engaging proactively with communities. We're identifying vulnerable communities, communities that are vulnerable to a warming climate. We're also trying to use this information to drive policy. As you may have heard, some of the recent the current administration has put together priorities such as Justice 40, where they want 40% of resources and efforts to go toward improving environmental justice areas. Well, how do you determine what's an environmental justice area? What information would you use to make that characterization? Similarly, as we're giving, as we are using funds through the recent infrastructure bill, as we're thinking about funds through Build Back Better, as we're thinking about how we're going to drive investment, particularly with an eye toward adaptation and so forth, we feel like if areas have information on their climate vulnerability, then they may be more inspired to take action at the local, state, and national level. There's a lot that you can do at a local level, but with climate in particular, I think there's a feeling of, oh, well, it's just too big of a problem. No one person can handle it. And so with this tool, we're hoping that there's an understanding that, yes, we're all at risk and we all need to take steps. And so we have included a number of different domains as part of building out this climate vulnerability index. And those domains obviously include some of the same ones that we used in HGB EnviroScreen, but we've added a few more. We've added baseline vulnerability infrastructure. We've added climate change impacts on health. We've added climate change impacts on we've included economic indicators. We've also included indicators related to extreme events. You can imagine that areas that are being hit over and over again by hurricanes or climate fueled storms, areas that are prone to wildfires, that those would need higher priority or would warrant higher priority as we're thinking about climate policy and how to drive investment, particularly in trying to build resilience within these communities. And I won't go through each of these, but you know, and you may ask, oh, why do you have all of these indicators? Like, does it make sense that say an uninsured indicator would need to be incorporated into a climate vulnerability index? And whether you're insured or not does actually play a role in your baseline health. And so if you are uninsured, you're probably not as healthy, or you're at least maybe not going to the doctor as often as someone who is insured. And so you may be at increased vulnerability for that reason. And so we have really tried to figure out what are all of the variables that are indicators that we might be able to use that would be incorporated into a vulnerability index. Things like HUD foreclosures, for example, on the baseline social vulnerability, housing type and transportation, minority status and language. Those are all things that play into what someone's vulnerability is. And then infrastructure as well. Whether or not you have internet access. We know that there are disparities in access to broadband, for example. Even voter registration, voter turnout. So all of those governance indicators, housing affordability, they all factor in. This is a baseline environment, which is similar to what is included in HGB and virus screen. And then climate change impacts on health. We know that there are, as the temperature rises, they're actually starting to see reports. You're starting to see reports about increases in out-of-hospital cardiac events because of that have been attributed to warmer climate. In part because of with a warmer climate, you expect to see higher concentrations of air pollutants like ozone, for example. The way that ozone is formed, it's formed by NOx, nitrogen oxides, and volatile organic compounds in the presence of heat and sunlight. So as you get warmer, you're actually catalyzing the formation of ozone and ending up with higher ozone concentrations than you would were it not as hot. So there are all kinds of ways in which air pollution and climate are intertwined. And then obviously the economic costs. I didn't mention this with Hurricane Harvey, but one of the most fascinating things about that event for me is that there were almost 1 million cars that were destroyed during Hurricane Harvey. They were flooded, otherwise, deemed as total losses. Whether someone has a car means that might make the difference as to whether they get to work or not. Whether they get to work or not, makes a difference as to whether they end up keeping that job or not. And so what we're doing is we're eventually, for people who have been marginalized or who are on that line between being able to take care of themselves and not, we're moving the needle further and further to the left, where it takes more and more and more to be able to take care of yourself. And so that's not good for anybody. That, in my mind, is why we're seeing higher rates of drug use, higher suicide rates. This is even before all of the COVID-19 and so forth. And it's because we are moving the needle in the wrong direction. More and more people are living on the edge than ever before. And then, of course, climate impacts and extreme weather. So looking at those massive rain events, Dr. Haley mentioned the $1 billion disasters in the country. Those are, eventually going to bankrupt us. That is something that we think is an important indicator. Also, how FEMA dollars are spent. We've seen time and time again in places around Houston, it's probably not surprising, the areas that are last to get cleaned up or last to receive funding to rebuild, or they may not be insured at all, and so they continue to live in homes that are damaged or have mold or have other issues. And so all of this factors into vulnerability. And so, as we're thinking about the climate vulnerability index, the use cases, things like community action planning, Justice 40, as I mentioned, identifying places to invest, transportation project prioritization, and public health planning, resource needs and allocations, and then interagency collaborations. We love what the administration is doing about trying to prioritize environmental justice areas. Obviously, there are just countless examples of racism all over the country. Trying to find ways in which we can address some of these longstanding issues is important, and having a way to do that. We've talked with several government agencies about, okay, well, now that you have, this executive order, how is it that you're going to, to meet the spirit of what Justice 40, is intended to achieve? And, a lot of times they won't say it directly, but you get a sense that they don't actually know how they're going to do that. And so providing those tools by which you can help show agencies like DOT or federal highways or any of the agencies, FEMA, how to better invest and how to maximize our how we spend our dollars and where we put our resources is incredibly important. And I wish I could show you a beta version of the Climate Vulnerability Index tool. If this conference were next month, I would be able to do that. We're going to have it in just a few weeks. But I would invite anyone who's interested in it to stay in touch with me, and I'd be happy to keep you in the loop as to our progress. It is a national-based tool, so we are excited about it. We've had conversations with EPA about using some of the data and information that we're collecting as part of some of the tools that they are using. And so we are expecting that that information is going to be broadly used for a variety of different activities. And then finally, I just wanted to put in a plug for the Society of Environmental Journalists in Houston. This is a conference that's happening at the end of March, and this is the first time that the Society of Environmental Journalists are focusing on environmental justice as a theme for their conference. This is the largest conference of environmental journalists in the nation, and so they haven't had an in-person meeting in several years, and so they're expecting the conference in Houston to be big. So we just invite you all to keep that in mind. And then just kind of one thing that I always like to remind everyone is that when we're talking about disaster relief, when we're talking about working with communities, really keeping the community's interests, what they want at the front. It's not, that we're just coming in and flying in to solve problems that we're working with the communities and not treating them as some kind of, laboratory. And so I always like to send a little note about that. And with that, I think I will take some questions if there are any.
Yeah, thank you so much, Dr. Craft. Someone asks, are there any other countries using this tool or perhaps something like it?
That's a great question. I don't know if there are other tools being used. I would imagine that there would be something similar in a place like maybe in Europe, for example, but I don't know of any off the top of my head.
Another question is, if you had the power to enact a single policy change on a state or national level to mitigate the disparities caused by climate change, what policy change would you enact?
Oh, that's a great question. I guess it depends on, do I have to take into consideration the cost in terms of that policy? There are things that are going to be extraordinarily difficult for our country to do. And one of those things is to transition our transportation sector to electric. And part of the reason for that is that the cost and the infrastructure that's going to be required to achieve that. It's not enough just that the passenger vehicles need to be electrified, but we're talking about the heavy duty trucks that are running in and out of the ports, the heavy duty trucks that are going cross country. We need to overhaul our entire transportation system. That comes with a price tag that is, obviously enormous. Is that better or more effective or more efficient than putting money into some of the solutions that Dr. Haley was talking about? So trying to remove carbon, trying to develop those technologies to remove carbon from the atmosphere, you have to weigh the costs and benefits. I agree completely with Dr. Haley that we need to do much more than we are doing right now. What we are doing right now is not gonna get us where we need to be. And so it really is battling it out about, okay, well, what makes the most sense? And, to be honest, as you all will find, I'm sure, the things that make the most sense are not necessarily the things that get turned into policy. And there are lots of reasons for that. People have various reasons for, the coal mining companies in West Virginia and Ohio don't want to see mining jobs go away because that's their livelihood. And you have to understand that. At the same time, I think it is about educating, our country and really making sure that that people understand the stakes and what is happening, and the fact that we're already seeing the impacts of a warming climate, and they're not going to be reversible at some point.
Do you think there are any more feasible policy changes that could be happening in the near future with the lower cost?
I definitely think more investment in renewable energies. For example, I don't think it makes sense to continue to run coal-fired power plants. They, on the one hand, they're some of the cheapest to run, but the reason for that is because they're some of the most polluting. And so you're not taking into account all of the health impacts that are resulting from the mercury, from the particulate matter that's being generated by those kinds of facilities. I do think it's interesting in states like Oklahoma and Texas that, the fossil fuel industry is not expecting to go away. And I think, with the build out of export facilities along the Gulf Coast, where we're sending LNG and other fossil fuel based products overseas, that, just moving it somewhere else is not a solution. That's not going to get us where we need to be. So I do think that it's going to take some national and international cooperation. I also think that we need more leadership from the private sector. We're starting to see that from some of the car companies. I think you've probably seen some of the announcements from GM recently about the enormous investments, the largest investment I think ever made in electric vehicles by a car company. And not, I would say probably not counting Tesla, but that's a big deal for for GM. And so understanding more, but I mean, again, this is happening, and okay, we're in 2022. This issue has been going on for decades. Where have they been? So that, not to disparage the car companies, but just as an example, we have not been moving fast enough.
Someone asked, how can I as a student participate in research that looks at climate change vulnerability?
I think there are lots of ways. I mean, I've seen tons of groups on different campuses that are, students for climate action. We actually have some work going on with medical students. One of the things that I would like to, is a personal interest of mine, is helping the medical community understand more about the health implications of climate change. If you look at the increase in rates or incidents of vector-borne diseases, for example, more dengue fever, more malaria, more Zika. I mean, these are vector-borne diseases are things that we see on the rise in different places, but no one's really paying attention to it or talking about it. I mean, obviously in the context of a global pandemic, is not rising to the high on the priority list at the moment, but all of those bits and pieces of information that are sort of just under the surface, and as we continue to get warmer and warmer, we're going to see more and more of that. So I think I feel like any major university, I would have to imagine, has some way for students to get engaged. The other thing I love that Dr. Haley said was, really getting involved in politics. I mean, people are making decisions about your future and they are going to make them, they might not be the decisions you want. And so really getting engaged and understanding the issues, speaking out at hearings is a great way to get involved.
Another question is, can you give us some examples of the wins you've had by working with industry such as fossil fuel companies?
Sure. So one of the things I think I mentioned is this need to transition to cleaner vehicles, and particularly some of the trucks that operate in and out of the ports. One of the things that some companies are doing, and these are really some of the most progressive companies out there, like IKEA, for example, like Nike, for example, they're actually requiring that that companies that they hire to move their products are that they meet some particular criteria. So by 2040, I think IKEA has made a commitment that they were going to be carbon neutral. And that means from scope 1, scope 2, and scope 3 emissions. And scope 3 emissions are basically indirect emissions. So those are emissions that, that they would have to account for on their books. There would be the emissions that the trucks that they hire would be generating. And so what that means is that they're going to be driving their suppliers to make changes. And that's really how you get this, wholesale impact, where you're able to encourage companies like that to say, hey, we can't hire you unless you're driving an electric truck. And so we just, one of the wins we just had, just was announced today, actually. EPA gave, I think the Port of Baltimore, in partnership with one of the trucking companies there, received $1.8 million for a demonstration project for a couple of electric vehicles to be operating at the Port of Baltimore with the trucking company that carries cargo for IKEA. And so that's going to be really a great demonstration, and it's going to show, yes, it can be done. It's hard. It's not easy. You can't be lazy, but those are things that that are happening that I think are exciting.
That was really exciting. Thank you. So a lot of us here today are healthcare students. So I was kind of wondering what advice you would give a healthcare worker or future healthcare professional who wants to help mitigate these disparities that are caused by climate change.
Well, one of the things that we have a partnership with the University of New Mexico, and the University of New Mexico, in partnership with the New Mexico Department of Health, is actually offering continuing medical education training to doctors. And the series is actually about climate change and health. And so learning more about the associations between nitrogen oxides, for example, and asthma rates, understanding about tools like the Climate Vulnerability Index or some of these environmental justice screening tools that can identify those areas where we know, just that there are disparities. And then, figuring out ways to empower those communities to install community air monitors. That's one of the things I'm really proud of, is that, we've helped a number of communities in Texas install and operate and manage their own air monitoring equipment. What that does is that it really puts the state environmental agency on notice, because all of a sudden these communities have access to data that they didn't have before. And so, encouraging more enforcement of the permits and so forth is important. And, there's just a lot of things. I would say in Texas and Oklahoma, one of the biggest things to do to reduce some of those disparities is to require that the state environmental agency enforce on permit violations. That is not happening in Texas. Our state environmental agency enforces on 3% of the violations that happen at facilities. So we have, thousands, hundreds of thousands of tons of pollution that are being released outside of what they're permitted to release. And there is no, there's no incentive to follow the rules, because they're not being held accountable when they break them.
I was wondering, do you have any advice on how we as future healthcare professionals can work as advocates?
Yeah, I mean, there are tons and tons of groups that are out there that I think, are trying to take taking, different approaches to trying to solve the climate crisis. I think it depends really what you're interested in doing. I don't really, when people come around, trying to get people to sign up for stuff on the street, that kind of, advocacy doesn't resonate with me as much. I feel like what's more useful or more impactful is helping a community write a proposal that they can use, that they get to help change something in their community. So volunteering, doing something like that, making, like, when you make decisions about what kind of products you're going to purchase, do a little research on the companies and see, are they, have they made a commitment to reduce their environmental footprint? if they haven't, I feel like those companies are, they're just not going to be around. So it's really about educating yourselves and figuring out, what's the best place for you. What are you comfortable doing?
Perfect. I think that kind of wraps up all our questions. Thank you so much, Dr. Craft, for being here today with us and for sharing this wonderful presentation with us.
Oh, thank you so much. It's such a pleasure.